This is Healthcare Bill part number 43, and I promised you that we would find Section 514 of the Employee Retirement Income Security Act of 1974, and guess what? We have found it, and it's right here. It's this big yellow thing. And I am not going to spend all night trying to decipher this for you. What I will do is I will put a link below this video where you can click it for yourself, you can read it, you can decipher it for yourself, you can leave comments as to what this thing actually does, so on and so forth. But like I said, I'm not going to do this for you, alright? However, there was also a reference to, hang on, Section 2791 of the Public Health Service Act. This one's a little easy to read, so I will go ahead and cover it. Alright, this section, Part B of this section of 2791, is talking about definitions relating to health insurance. Health insurance coverage is defined as follows. Means benefits consisting of medical care provided directly through insurance or reimbursement or otherwise, and including items and services paid for as medical care under any hospital or medical service policy or certificate, hospital or medical service plan contract, or health maintenance organization contract offered by a health insurance issuer. Whew. You can decipher all that, you're more than welcome. Health insurance issuer is defined as follows. An insurance company, insurance service, or insurance organization, including a health maintenance organization as defined in paragraph 3, which is licensed to engage in the business of insurance in a state which is subject to state law which regulates insurance within the meaning of Section 514b(2) of the Employee Retirement Income Security Act of 1974, which of course we just located. Such term does not include a group health plan. A health maintenance organization is defined as follows. A federally qualified health maintenance organization is defined in Section 1301A. An organization recognized under state law as a health maintenance organization. A similar organization regulated under state law for solvency in the same manner and to the same extent as such a health maintenance organization. We have group health insurance coverage, which is defined as the following. In connection to a group health plan, health insurance coverage offered in connection with such a plan, and this continues on talking about individual health insurance coverage, which they give a definition here too. You can read all these for yourself. They're right here on the internet. I'll go ahead and leave you a link to both, and you can just read those to your heart's content. Okay. Well, I think it's about time we go back to this. In a previous video, we talked about Section 1302, Essential Health Benefit Requirements. Okay. And we went through Part A, and we talked about Part B a little bit. Now we're going to talk about limitation. The Secretary shall ensure that the scope of the essential health benefits under paragraph 1 is equal to the scope of benefits provided under typical employer plan as determined by the Secretary. To inform this determination, the Secretary of Labor shall conduct a survey of employer-sponsored coverage to determine the benefits typically covered by employers, including multi-employer plans, and provide a report on such a survey to the Secretary. So in other words, he's got to go to every employer, the Secretary of Health and Human Services, he's going to send somebody out to every employer-based program. And these are employer-based health insurance programs. They're going to see what they're offering, and then they'll come up with a general whatever that every insurance has to offer. Certification defining the essential health benefits described in whatever, and in revising the benefits under paragraph whatever, The Secretary shall submit a report to the appropriate committees of Congress containing a certification from the Chief Actuary of the Centers for Medicare and Medicaid Services that such essential health benefits meet the limitation described in paragraph 2. So, once this Secretary of Health and Human Services gets all this information that I just talked about a minute ago, he is going to submit a report to Congress, and they'll take it from there. Notice and hearing in defining the essential health benefits described in paragraph 1 and in revising the benefits under paragraph 4H. The Secretary shall provide notice and an opportunity for public comment. Required elements for consideration in defining the essential health benefits under paragraph 1. The Secretary shall ensure that such essential health benefits reflect an appropriate balance among the categories described in such subsection, so that benefits are not unduly weighted towards any category. And this goes on and on and on. And we're going to stop here on page number 46. And I will tell you more in a future video, so stay tuned.